So the important thing here, ladies and gentlemen, is that I passed, even though I missed those questions, and most of the questions were about pregnancy, if you ask me. This will be testing my health promotion and maintenance skills in real time. There's 20 questions. You have to get a 50% to pass, just like the NCLEX. I've never seen this exam before. I will talk it through so you could see my strategies in action. Okay? When making a checklist for an older adult who is learning to do self-catheterization, which action is most helpful? Pause the video if you want to see the choices. I'm just going to go ahead and answer the questions and talk about it as I see fit, okay? Okay. Now the question was, when making a checklist for an older adult who is learning to do self-catheterization, which action is most helpful? And I chose the correct answer. Use short words and sentences. Again, pause the video and read the rationale. And you also might want to write these questions down for your own studies if you want. Okay, the healthcare provider is teaching a patient with emphysema pursed lip breathing. Pursed lip breathing helps patients with emphysema because it Okay, I chose helps keep the small airways open and prevents air trapping. And that was correct. I'm going to bring the rationale into focus for you so you can stop the video and read the rationale. So far, two questions answered. Okay. After educating a 19-year-old client about possible adverse effects of oral contraception, which of the client's concerns shows lack of knowledge? And I'm going to pick, I can see it right now. This is an oral contraceptive, so, they might experience headache, they might experience weight gain, they might experience nausea, but they will not get ovarian cancer. And that's correct. Next question. During a routine prenatal visit, I'm not good with prenatal, All right, so if I was taking the NCLEX, I'd be like, oh my God, a prenatal question. But I have to stop, take a deep breath, close my eyes for 3 seconds, open my eyes, and what I just did was I pushed the reset button. I tell my clients when they're experiencing anxiety to close their eyes, take a deep breath, and pretend that's a reset button. So I'm not going to worry that this is a prenatal and I don't know anything about prenatal. Let's read the question and try to use logic when answering this question, okay? During a routine prenatal visit by a woman at 24 weeks gestation, the healthcare provider notes the woman's pre-pregnancy hematocrit was 42%, but today the hematocrit is 34%. Which of the following provides the best explanation of the change in hematocrit for this client? Again, I don't know, so let's take an educated guess. Above all, we must stay calm for the NCLEX, right? So, okay, the first answer is about nausea and her diet's been poor. There's nothing in the question about diet, so why would I pick that, right? The answer could possibly be B. Because of the pregnancy-related immune suppressant, the woman is not making enough erythrocytes. That's blood-related, so let's keep that answer. During pregnancy, the increase in plasma volume exceeds the increase in erythrocyte production. Again, I don't know, so let's keep that answer, right? I like the woman is anemic because of her blood is being diverted to the placenta and fetus. I like that one. Let me pick that one. It's probably wrong, but again, we're going to come across questions on the NCLEX that we don't know. So we must stay calm. Don't worry. I'm going to pick it because I feel it. And I'm wrong, but that's okay. So, the answer is C. I'm going to move the question up to let you read the rationale. Pause the video to read the rationale here, okay? Alright, so I missed one. It's okay. I won't know I missed it at the NCLEX, will I? So far I got 3 right and 1 wrong. Let's continue. A client calls the clinic after home pregnancy test is positive. Which hormone will cause this result? Now, I should know this one. But again, pregnancy and all that is my weakness. But let me go ahead. Oh, I'm going to pick, I do know this one. HCG. HCG, because I called the doctor. I told him I might be pregnant. He asked me, are your breasts tender? No. Have you missed a period? I don't know. He did the HCG, and I only had like 400, and he couldn't do anything for me. He said, how did you even know you were pregnant? Your HCG is only 400. Go home, come back in a month when your HCG is 400,000. And the doctor was amazed that I even knew I was pregnant. So I know this because of my own experience, and I'm going to pick A. Notice I said because of my own experience, not what I saw at work. Okay? All right, so pause the video if you want to read the rationale. I'm going to continue because I'm taking this exam in real life. This is real. This is like what it's going to be like at the NCLEX, okay? You're going to miss some. You're going to win some. The key is not to be anxious. A school nurse is performing annual scoliosis screenings. The nurse assesses students for all the following signs except, I'm going to say balanced waist angles, because scoliosis, you have that crooked spine, right? They kind of lean to one side, so you might have uneven hips. I'm going to say balanced waist angles, because they'll be unbalanced because of the spine being crooked. That's my thinking. See how I'm doing critical thinking skills here? And that's correct. Again, pause it to read the rationale. Uh-oh. Okay, notice I just went uh-oh. Why did I say uh-oh? Because I forgot about Erickson. So, close my eyes, take a deep breath, count to 3, open my eyes, reset button. Now, I have studied Erickson, so if I feel I don't know it, take my best guess. Right? Above all, remain relaxed. Okay, so what's appropriate for a 16-year-old? Psychosocial development, 16-year-old. I would say request the hospital chaplain stop by. Because all the rest have to do with oh, wait a minute. Ask parents to assist with missed homework? I still don't think a 16-year-old cares about the client. Chaplain. They should. It says most appropriate. Oh, most appropriate. Ask parents to assist with missed homework. That's appropriate. Then the chaplain. What do you think about that? Let's answer. Ooh. Oh. I'm wondering if I answered this most appropriate. I know. Oh. Okay, I was thinking about this question wrong. I know that friends and family are very important for a 16-year-old. So I missed this because I read the question wrong. Encourage friends to visit the hospital. Okay. Friends are very important for a 16-year-old. Again, read the rationale. I'm not going to read it. I'm just going to keep going as if I'm taking the NCLEX, okay? During a home assessment of a 2-year-old, which behavior indicates normal development? Tries to cut food, knows how to eat with a fork, tries to cut with a knife, pours milk into a cereal bowl. No. Uses a cup to drink, of course. So that was the easy one. So I think that was easy because I missed my last question. Okay. Again, read the rationale if you're writing the questions as you go. Let me take out this advertisement for you. When teaching a client who is planning to get pregnant about the need to increase folic acid, which food can the nurse suggest? Vitamin B, I would pick the spinach. I'm going to speed up. No, I'm not going to speed up because sometimes when you speed up, you mess up. Now, if you're an RN, you have 44 questions in an hour. That's 1 minute and 13 seconds per question. If you're an LPN, you have 41 questions an hour to answer. Okay? If you want to not run out of time at the test center. Okay, let's continue. The home health nurse is visiting a new client with COPD who was just discharged from the hospital. Which is the most important topic for the nurse to teach the client? just diagnosed with COPD. So, okay. Home health nurse. So let's stay with the home, right? So removing potential lung irritants from the home. I would do that. Importance of maintaining social ties. It doesn't talk, okay, this is COPD, so it doesn't say anything about friends. So it's a choice between starting a gradual exercise and walking program. Now, I would still choose removing potential lung irritants from home. Chronic obstructive pulmonary disease. So when they inhale, what are the things that, those potential lung irritants will cause them to cough? So let's choose that. I think that's most appropriate. Better oxygenation and less CO2 retention. What? Quit smoking? No, CO3 is smoking. Well, I wouldn't have guessed that. Again, let's read the rationale. Pause the video and read the rationale because I got this wrong, okay? Alright, let's continue. By the way, cigarettes have carbon monoxide in them, which is CO3. Alright, let's continue. A 17-year-old girl and her mother are both in the exam room for the girl's school physical. Before asking the girl about her sexual history, which statement should the nurse take? Well, the girl is 17. So in some states, you could give 16-year-old girls oral contraceptives without the parents knowing it. So I would guess it's ask the mother to leave the room. Let's see. And that's what A is. Do you think your mother should leave the room now? I don't know if I would ask the girl that because she's going to say no, maybe. Let's read the other ones. Mother, I'm going to ask you to step out so I can complete the health history. I would do that one. Mother, do you think your daughter's sexually active? Of course, the mother's going to say, oh, not my daughter. And the daughter might be, right? So I'm going to pick B. Ask the mother to step out while you do her physical. And that was the correct answer. Again, I got the one before that wrong. So maybe this was easier because the one in front of the last question I answered was wrong. But pause the video, read the rationale, let's continue. When caring for an elderly client who has visual and hearing impairments, which of the following should the nurse assess? I would pick social isolation, believe it or not, because maybe they cannot hang around other people because they can't see them or hear them. Or maybe they get irritated because they have sensory overload. And, this just says impairments. It doesn't say which kind. But I think social isolation. Let's try it. Oh, good. I got that one right. Again, pause the video, read the rationale. Let's move on. The nurse notes the apical rate, heart rate of a neonate born 5 minutes ago is 152 and regular. What should the nurse do? Well, 152 and regular is normal, I think, right? I know it's 160 or higher euro, right? So when they're first born, I would imagine it's high. So, again, neonate being my weakness, so what am I going to do if I get anxious about it? Pause, close my eyes, count to 3, reset button, open eyes, stay calm, take my best guess, right? So, monitor the heart rate every 2 hours. I would document a normal heart rate, but again, I think it's normal. So let's see. Again, I'm not nervous. I'm just going to pick what I think is right. And I was right. If you want to read the rationale, pause the video. Let's move on. As vision changes with age, the ability to see colors can be altered. When the home health nurse helps an elderly client choose an outfit, which colors are most difficult for the clients to distinguish? And I know because I'm terribly nearsighted, and the most is red and green. So, I'm going to pick D, and that's because of my own personal experience and what I know to be true. On the NCLEX, blue and green. I always thought it was red and green. Okay, not going to worry about it. All I need is a 50 on the NCLEX. Stay calm, Garrison. Read the rationale and move on. A 79-year-old client with severe arthritis of the hands tells the nurse she has difficulty instilling eye drops for glaucoma. What can the nurse plan to assist the client? Okay, refrigerate the eye drops to increase viscosity. She's got arthritis, so she can't even hold the bottle, right? She's having trouble holding the bottle. Instruct the client to lie down when using the drops. Teach the client to tilt her head back. Ask a family member to take over the task. Ask a family member to take over the task? I don't know, something like refrigerate the eye drops to increase viscosity is probably the answer, but let's do it. Ask a family member. My thinking is she's got arthritis of her hands, so she has trouble holding the bottle. But what if she doesn't have a family member? Let's try the family member. Damn it. Okay. Instruct the client to lie down when using the drops. I don't know how that's going to help her hold the bottle. Let's pause the video and read the rationale and move on. Okay? A mother tells the nurse that her 8-year-old client doesn't eat as much as her toddler or the teenager. The nurse should explain that the school-aged children have a lower metabolic rate, no, because they run around. Activity level, no, because they run around. Hormone level, no, that's when all the hormones are starting to build up in the body, right? Release. So I'm going to say growth rate. Toddlers tend to grow and teenagers tend to grow. But around 8 years old, they slow down their growth rate. So, all right, let's read the rationale by pausing the video, but let's move on to the next question. The nurse plans to instruct parents of a 4-year-old with cystic fibrosis about the child's nutritional needs, which should be included during teaching. Cystic fibrosis. Well, they're in a lot of pain when you have cystic fibrosis. You have a lot of mucus when you have cystic fibrosis. You can have mucus. So, the child is 4 years old. So I know you don't want to give. I'm going to pick low carbohydrate. That makes sense. That's even good for a normal diet. The other choices I have is high fat, no. High calorie, no. Low protein, no. I'm going to go ahead with the low carbohydrate because you should have low carbohydrates even as an adult, but I'm probably wrong. Let's see. Yeah. I was thinking because the child's 4 years old, so the child needs a lot of calories. But anyway, I missed it. Let's move on. Pause the video to read the rationale. Let's move on. The nurse is instructing a 53-year-old male with newly diagnosed type 2 diabetes how to care for his feet at home. I thought you're supposed to go to a podiatrist. Anyway, which statement indicates the client understands? Okay, you should not go barefoot. Every Sunday evening I will inspect my feet. Well, I think you should inspect them every day. I'm going to pick dry my feet very well after each shower. Yeah, let's pick that. Of course, that was right. That might be because I missed the one before it, but let's continue. A patient reports smoking 10 cigarettes per day for 40 years. How will the healthcare provider document this patient's smoking habit in terms of pack years? 10 cigarettes a day for 40 years? That's a half a pack a day. So that's 20 packs in 40 years. Yeah, there it is, 20 pack years. What a dumb question. Again, it might be because I missed the other. I don't know. Pause the video, read the rationale if you need to, and let's move on. Remember, on the NCLEX, all you need to get is a 50% to pass. Here, on this exam, all I need to get is a 50% to pass. And as we continue, I will go ahead, and I really should start doing this where it's appropriate. And in the next exam I'm going to actually, that I do on video, I'm going to actually do clinical judgment and all the strategies that I teach you. I'm answering the question in this exam like most of you do. But when you tutor me, when I tutor you, I'm going to give you tools. And I want you to use those tools. So I'm going to show you how to use the tools in my next video. But in this video, let's answer one more question and see how I did. A 32-year-old client refuses to have any analgesia or anesthesia during her birth experience. First of all, we're having a non-medicated birthing experience. Second of all, this is my weak area, so what am I going to do? Remain calm, Garrison. Breathe. Close my eyes for 3 seconds. Open my eyes. I just pushed a reset button. This is not my strong point, so I'm going to have to take an educated guess. I studied this, it's just not my strong point. As the nurse assists her during the second stage of labor, which position should she use to begin pushing? Knee chest with head elevated? I think that. Squatting with the body curved in a C position? No. Lying on her left side in a Sims position? No. Lithotomy with high stirrups? Oh. Lithotomy with high stirrups. How about lithotomy with high stirrups so the doctor can assist getting the head out with forceps should he need to do that? Let's pick D. One I would have never picked. Squatting with her body curved in a C position. Oh, all right. So now I know what position to use when you don't have any medication. All right, let's see how I did on my exam. So the important thing here, ladies and gentlemen, is that I passed, even though I missed those questions, and most of the questions were about pregnancy, if you ask me. I got a 65%. All you need to do to pass is get a 50%. So when you get nervous on the NCLEX, one thing I do know is when you get nervous on the NCLEX and say, oh my God, I never studied this, this is new to me, every time you think that, remain calm. Remain calm. Close your eyes. Take a deep breath. Count to 3. Open your eyes and take an educated guess. You studied it. You just don't remember. So I passed, and that's my point. All right. Now, the next video I do answering questions, I'm going to start using my concepts, my strategies that I teach you during tutoring. All right. I'm not going to teach them to you, but I will vocalize what I'm using. All right. This test is finished, and thank you, and I'll see you in the next video.